The other sign is starting to reset.
I'll do the traditional 5-minute wait.
Yes. No mind.
No, yeah, definitely.
Go ahead and sign in while you guys walk in up there at the laptop. Bye. Oh, yeah. 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 I think that would be nice. It might be nice to hear. Okay.
I think you just got a text message or something. Got a text message.
Oh, I did.
This is my puppet.
It probably will look better with it off. Yeah.
Just committed a cardinal sin. Don't turn the light off for black people. But no, it's okay, it's okay. I'll just kidding. Well, should I go ahead? Okay, well, thank you guys for coming out. I appreciate this. Right, before I get going, where's the best place to get food on campus?
On campus?
On campus, anywhere on campus, but in walking distance of here. So, like, where would you go at noon to get lunch or whatever? Oh, Chipotle, I see. That's cool. All right. Well, my name is Emmanuel Appiah-Kubi. I'm one of the physicians on campus, and I'm a nuclear medicine physician, and it's a pleasure to meet you guys here. I'm originally from Ghana. My family, I was born and raised in Ghana. When I was in high school, at age, probably at the end of high school, my family moved here to the Bronx, New York City. Then myself and my siblings were put in schools, and we had to be put in a really bad school. So I made a decision to skip high school and not go to high school. But I'm here, so that it turned out well somehow. So I stayed at home and studied, and I was working for a couple of years. And when I turned 20, I was like, this is not going to be a good life if I keep going along this track. So thankfully, right across the street from my mom's house was a library. There was a library, so I walked in one time and I met this old guy. He was probably like 100 years old, and he was my savior. He told me about SAT, ACT, and I studied hard, and I took my SATs, but I did really well on them, and that was also my saving grace. I had probably close to perfect scores on all of them, and that was my saving grace. And I applied to college with some guy coming off of his mom's college with no GED high school, but really great SAT scores. So University of Buffalo took a chance on me. Of course, I got rejected from everywhere else. Ended up back in the Bronx for med school at a small medical school called Albert Einstein College of Medicine in New York City. Then from there, I started off in general surgery. I wanted to be a surgeon and impress my parents, and I loved surgery, so it was fun. But after doing that for a couple of years, I needed a change of pace. I needed to slow things down a little bit. I thought surgery for me was not compatible over the long run, so I made a switch into nuclear medicine, which is radiology, nuclear medicine, and great field, good quality of life, gives me the chance to come and talk to you guys after work. So, and then I switched to UCLA, University of California, Los Angeles, for my residency in nuclear medicine. Then I started off working at UCLA for a little bit, and these guys came and got me. They got me with an offer I couldn't refuse. Else, no one would ever move from LA to Columbus. But it was a great offer, and I'm happy to be here, and nice to meet you. Now let's jump into global health. Eventually, I want every one of you to tell me about yourselves, right? I just told you my whole life story, so hopefully at some point I'd like to share about. I know Courtney's from Chicago, and you're from Columbus. So anybody else from Columbus? Oh, nice. How many pre-meds are here? Anyone wants to go to med school? Ah, yeah, that's great. Well, welcome to let's talk about global health then. So, just to give a brief overview, global health. In 2017, these fancy people, the United States and a few African countries did a survey in African countries, and they realized that out of every 100,000 pregnancies, 330 women die for no reason than they're women in sub-Saharan Africa, period. You know the kind of people who get pregnant? Young girls, right? They're not old women with problems. They're just usually younger people and stuff like that, right? So this was very alarming, right? And if you break this down, it's like filling a Boeing 737 with pregnant African women and crashing it every year, right? It's just absurd. It's too high, right? Just for comparison, the United States, it's about a 7 out of 100,000 pregnancies, right? Which is much smaller than this, right? So this is a really significant public health crisis that we should all be aware of. Probably worse than COVID, if you ask me. Because this is going on and on and on. A lot of women dying every year. Crazy, right? A few causes of death, just dying, from hypertension and all these things that are preventable. I won't go into a lot of the details because it's too medical right now, right? A few of the causes here, I won't go into detail. But then we get into kids, right? And we realize that kids are no better than the women, right? So you realize that this graph shows us that out of every 1,000, so basically out of every 100 kids, 5 will die, right? Five kids will die out of 100, right? Which is really just absurd, right? It's almost like every 10.5 or like 1 in 10 kids. Just absurd, unthinkable, right? For the sole reason that they're kids in a specific location in the world, which is just mind-boggling, right? So it's just insane. But thankfully, it was a lot worse. It was a lot worse, in the 1980s. It was like 155, right? It was probably like what, out of every 10 kids, 2 would just pass and die, which was not a good thing, right? So there's this really bad public health crisis going on there, right? It turns out that it's more dire when these kids are under 2 years old, right? Then it goes up from 52 to 90. It's like twice as much if the kids are under 2 years old. Kids have they're the most healthy population, right? They're kids and there's not much going on, So if that many 1 out of 10, 2 out of 10 are dying, there's no explanation, right? It's just not good, right? And it turns out that as the kids grow older, it kind of goes down a little bit, right? So the 3-year-olds are like a little better than the 2-year-olds, right? And then after 4 years, it kind of goes down, but still not good enough, It's still 1 in 10 kids dying. It's just too bad, right? So I decided to not be the know-it-all doctor, right? So I just decided in 2011, myself and a couple of colleagues of mine decided that we were going to go to West Africa and understand what was going on, right? Learn from the people what was going on and get on the ground and get in these villages and see for ourselves, right? So that's what we did. In 2011, we would go into villages and just go work in these communities. So we were medical students at that time. But then we grew up, we became more senior medical students, and then we'd go into communities, and then we'd go into to interact with people and to talk to people and, love them, give them the chance to love us back and know what's happening and understand their culture, understand why they do what they do. So we did that for like 6 years. And in 2018, after doing that, we decided to take a step back and process 6 years of data, what we've understood, and we realized that we can have a lot of solutions, right? We can create a solution to fix some of these healthcare disparities in these villages. I was a student then. I wasn't even a doctor at that time, right? But it doesn't take a doctor to fix all these problems. So we took a step back and we decided to make one more trip into the community, into the West African community, to talk to people, engage them. And this is one of that trip there, right? So we decided to talk to a few of the women, right? A few of the women who will benefit from our solution, right? A few of the women nurses, women doctors, right? Because these are the women that we are trying to create a solution for them, right? So they have to have an input in whatever we're doing, right? So yeah, we talked to all of them and some of the fathers too, right? Some of the fathers, male doctors too, since they also, their inputs will be key and critical, right? And then we built consensus with the local community. And that was in 2018, before we started to implement anything, and just go get close to the people, let them talk to you, right? Don't pretend you know it all. No, just shut up, listen, and let the people talk to you, right? Good. So can anyone guess what this country is? Yeah, great, right? Yeah, so yeah, definitely that's why we built our consensus, and it was good. It was a fun trip, and all these trips are also great. We enjoy going on these trips. And then would also, this is a few of my team. That's me right there in the middle. And then this guy was the Attorney General in Ghana, and this guy was the Minister of State, right? And then a few of my colleagues here, who were all in medicine, we went and engaged the political leaders, right? The presidents, ministers, and this and that. Hey guys, we're here, and this is what we want to do. This is what we're trying to do. We think there's a big healthcare crisis, women dying and little kids dying, and we want to hear what you have to say. Talk to us. We will shut up and listen to you, right? So they will have an input, right? The leaders will have an input into what we think we can achieve here, right? So that's what we did then. And then I met this cute little girl, Audrey, going through one of the villages. I ran into this girl. She was the cutest girl ever. I could not work. I just spent the whole day just hanging out with Audrey. Audrey is so great. And up until this day, I still keep in touch with her mom. She lives in a small village, and she can be so cute from like natural beauty, you know. So she was really, really cute. And I think she's gonna be a doctor. I gave her a stethoscope, you know. So someday Audrey will grow up and become a doctor for all of us, right? So now let's take a tour through Africa, right? So here down here we have Ghana right in here, right? And then to the west, there's Senegal, and then there is Mauritania, right? All the way in the south, we have South Africa down here, right? This part of South Africa is the bougie, high-end, glamorous part, right? Cape Town is right over here. The other part is called they call it the Terror Coast or something like that, you know. There's Durban. There were these recent riots on this side of South Africa, so this is the poor part. So just so you know, and of course Madagascar is here. The United States is all over there. So let's highlight Ghana, right? Now before I go on, we're right somewhere over here. Is that correct?
Yeah.
Yeah. So I did residency here. Can someone guess what city this is that I'm pointing to? The city? I'm sorry? I'm sorry? Yes, that's Los Angeles, right? LA. LA is right over there, right? So yeah, so that's gone over here, and then I mentioned all these things. But I also want you guys to take note of this, right? Can anyone guess what country this is? Brazil, right? And then on the horn of Brazil, there's a state there called Bahia, right? Bahia is a state in Brazil. And on the horn of Bahia is a capital called Salvador. And in Salvador, there's a small slum called Itapuan. I mentioned all these places for a reason. We'll get to them, right? But I want us to have a general global picture of where what is, right? And if you can see, from Ghana to Brazil, it's not any further than from Ghana to South Africa, right? So very interconnected, all right? So one country at a time. So we have the coast in Ghana, we have the city of Accra, we have Cape Coast, we have, which is the coastal town, we have Tamale in the north. There's this place in the north too, and then on the eastern part of the country, lots of rivers, right? Lots of rivers and mountains and Lome and all that. But let's take this place and start with Tamale, all right? So this is Tamale. That's where all the wildlife is at, right? All the big cats and the elephants and this and that, and great architecture. This building is famous. It's like 700 years old. It's just made from clay and soil, you know. So it's a really cool building, and you know, a lot of times we get there and we can hang out with the animals, and it's a great place. But I want to so this was myself and my team. This was actually myself, my team, and a few students, a few pre-medical students. We went in 2019, right? And this river here is called the White Volta, right? And it cuts off half of this city away, right? So the main city is over here, but then there's people living on the other side of the river, and there's no bridge. So if a woman goes in labor at 11 p.m., the other side of the river, what happens? She's in trouble. Because see, we have to get on boats. You put your motorbike on the boat, and then you cross the river with your motorbike on the boat to get on the other side, and then you're going to have to ride your motorbike another 45 minutes to get to the city. So if a woman is in labor on the other side at 11 p.m., she's in a lot of trouble. she's almost gonna die, right? If a kid is sick for whatever reason, and if it's raining during the daytime, it's raining, the river is probably uncrossable, so he will probably be in a lot of trouble and will probably die, right? So it's a really unfortunate situation here, right? So we decided to put up a clinic on that side of the river, to help our women's health clinic, to women's empowerment clinic there, and that's the design there, right? And as you can see here, we have most importantly, we have a delivery room to take care of the women. They can give birth and stuff like that, right? We also have the female ward here, where they can have the medications, be seen. Yeah, and yeah, the guys, we put them somewhere in the front, but yeah, definitely, that's what we were trying to do. But we didn't want to come in and give the community fish. We teach them how to fish, right? You want to teach people how to fish as opposed to give them fish, So we engage them and let them build a clinic for themselves, right? So this is a community, and we help them. We make them. We kind of get them together, get the local builders and carpenters and this and that, and moms and dads to get together and build a clinic for yourselves, so you can use, your woman can have a safe place to go and give birth, right? Look at this little kid. He's enjoying being there, and he will grow with this, right? So you put up this facility there, and the whole community comes together and they enjoy it. They take ownership because yes, they built this, right? I'm not there. I'm not in this picture. They are doing that themselves, right? So it makes them proud that hey, we're doing this and we're able to impact our own health, and we are doing this by ourselves. And I think that's important, right? And this was during COVID, so we got slowed down a little bit, right? And then they kept progressing, and now voila, right? Now they put a roof on it, and they're slowly going up there, right? This guy is amazing. He's a project manager in the community. These are community members. This guy is he's in the PhD school in the city on the other side of the river. So these are like two young people in the community who are going to school, and are very educated. But they also feel part of it. They come back, on vacation. They come back. Hey, the clinic we built in our community, and it's great for all of them. Now let's take a look at this side of Ghana with all the big lakes, waterfalls, rivers, and all of that. And it's a really great part of Ghana, the Volta region. And down here it's called Lome. Who has been in a waterfall before, a real waterfall? No one? Oh my goodness. You're gonna have to fix that. Oh, you have. Where'd you go? That definitely counts. That definitely counts. Is that in a grill? Oh, I see. That's good. That's good. Okay, cool. Excellent. Yeah. So this place is great. It's great with all the waterfalls and stuff like that, right? So we engage the locals, right? Like, hey guys, we can help you because you don't have healthcare, right? There's that part of the there's like the rivers, and there's nothing in that whole area. So we engage the local community, and they were like, this is great. This is amazing. We don't have to build anything from scratch. We will donate a building and convert. We will try and convert this into a clinic, right? So they at least did something and give us a whole structure. This is a piece of crap, but at least something, right? Something to start with, as opposed to nothing. If a woman gets into labor here, it's literally just a flip of a coin, right? If she's in labor, it's really, if she doesn't survive naturally, she will die, and that's not good. So that's good enough. So we decided that, hey, you guys have done enough. We will fix this, right? So we will convert this piece of crap a little bit. So we did some work to it and gave it a nice little facelift, right? And as you can see, it's already having an impact in the community. This woman is just like chilling in the front, just making her quotes, which is good, People could come in there, and it's a place that they feel that, hey, this is a place where I can be safe and come here and have healthcare, right? This guy in the white shirt, that's the local chief. He's the guy that donated the building to us, and thanks to him. And this was good. So yeah, we did this, and then myself and a few pre-med students went there 2 years ago after we had painted it and did this and that. Met a few of the community leaders. That's me right here, and that's she's a pre-pharmacy student right now. I think she just dropped out. She's not going to do pharmacy anymore. She's going to go into multimedia. And these two students are all pre-meds as well. But also, I want you to see in this picture here, right? These girls are local nurses and midwives, right? So whenever we walk around, we bring these guys with us because they are going to be working in these clinics. We want them to see the whole project from the ground up, right? Hey, like, if you're going to be working in here, look at why we're doing what we're doing, right? See how this whole project started from nothing. So yes, they are part of it, and we don't want it to feel like I'm the American guy who's coming in and fixing the problems for you. You're fixing your own problems. So come be part of us, and then know what we're doing, take ownership, and then when the clinic is done, you can work in there and help empower some women, take care of women in there. All right. So that was good. There was another guy here. He's in the brown pants. He's the ultrasound technician. And ultrasound is definitely critical in all of medicine, especially maternal health, right? You need to be able to take ultrasounds and see what's happening with the baby okay, and this and that. So that was that. So this was the team. That was me here, and this is the chief and a few of our pre-medical students. He's actually a physician in Germany. He joined our team from Germany. He came with us as our project manager. This is the ultrasound tech. And these guys are the local nurses and midwives. She is a princess, so his granddaughter, and she kind of led us to the chief. Behind the back, this is our beast mobile. You know, the one that's how we kind of moved around and through the villages, and it was fun. And that was good. So this is the whole team, and these people were amazing, and we had a great time here meeting the local chief. Now I'm gonna go to a different part of the country, all the way in the coast, right? So yeah, it's infamous for the slave castle, the door of no return. It's right over there. You know, this is where a lot of the slaves in Africa were kept and then shipped off to the Americas. And this is the castle here. Can anyone guess who this guy is? Any guess? Who's this guy? I'm sorry?
No.
Oh, good guess, but not no.
Yeah.
Anybody else? Just guess. It is Barack Obama, right? Yeah. Yeah. So that was Barack Obama. He visited the castle here during his presidency. But then again, it's in a place where, you know, it's abandoned and, you know, not a lot of healthcare opportunities there. There's a lot of strong issues there. But the bigger issue there is twofold. Maternal women and like eye problems. For whatever reason here they have lots of like eye issues and stuff like that. So we're like, okay, well, we'll come in and we'll see what we can do. We'll help you, help yourself, and solve your own health problems, right? So then again, you know, we came in with our plan, and then we got the community together. They started working and built this from scratch. I didn't build this. I don't know how to build, but we got the community together to see a problem that they probably didn't even know that was a problem, right? They didn't even know that, hey, our women dying whenever they get in labor is a problem. We're like, hey, guys, dude, you have a problem. You got to fix it, right? So we helped them, and they got together, put up a small facility there where we can have a little operating room back here, ward, and then an exam room. And then back here, there's another room that's going to be used as a ophthalmology eye center, you know, where they can get their eyes checked out. A nice little waiting room in here and stuff like that. So this was good, and this was how it's progressed. You know, it's progressed a little bit, just going on and showing all the little rooms in there. So yeah, they're doing a good job, and they're usually very excited to solve their problems. When you make them aware and you get them together, and they just take off and they go. So it's really incredible. And you know, this was in April 2021, and I think now it's much more progressed than this. I don't think I have any more updates, but you know, these guys are doing a great job. I think this clinic is probably almost done actually, and I think they are looking to open this clinic in December 2021 in like 6 weeks. You know, so which was great. So yeah, this is it's much more advanced. It's almost a complete clinic right now. And then in the central region of Ghana, it's known for all the gold and all the dense tropical forests, great hiking trails, guys. So it's a great place to go hiking. The famous Ken is called the Asante Hene. He's one of the more powerful guys. Number two producer of cocoa behind the Cote d'Ivoire. So it's a great place. Then you get to the same issues of where there's a place where there's a river called the Assam River. It's like a huge big river comes in and it cuts off the river, cuts off the whole community out. So with no bridge, so people on the other side are in a lot of trouble. They can't do anything. And the same concept, we actually did something very different this time around. What we did was we got students from the university in the city to come into the community, and so that's a new twist we brought with this project, right? So the community will do it, but now we bring in young students from the city, right? Hey guys, go and help this community, help them be organized, help them build this and that. And these are the two students, right? Amazing kids, amazing students, and they've done a great job. They were able to bond with the community guys. Unfortunately, we ran into a unique problem here. We told these guys that they had a problem, that they don't have health care, people die, and they didn't believe us. They thought we were just like, what does that even mean? They don't need a clinic. They don't want a clinic. It's not necessary. And when their people get sick, their people die. Unfortunately, the chief of this place got sick of some minor infection and died. And we're like, guys, case in point. And then and only then did they realize that, oh, wait, maybe what these guys are saying is actually true, right? We actually do need a clinic. So then eventually, I guess the chief dying is not a good thing. But the good thing was that, they actually saw that what we were saying is actually true, that they need to be able to take care of themselves when they're sick, right? So then they came around and then they started working on this project, and this was how they started. And then now they built this, and it just went up, and that's where it was a few weeks ago. And I think now this will also probably be complete by the end of the year as well. And they're doing an amazing job. Even though they started late, they caught up. Right? Oh, this is a video. I didn't even realize. So yeah, that's them. That's them on the clinic, and just doing a little work there. It's a much smaller clinic, but it's better than nothing. There was nothing in this place, but at least there will be a clinic where one clinician can come in and see people and take care of the locals. And hopefully, if we can get a young person in the community, sponsor them to go to school, nursing school in the city, become a nurse, and then bring them back so that they can go along the same token of, hey, we don't help you, you help yourself, right? So, and even if we can get a brilliant kid from the community to go to med school and then come back and become a doctor, that will be even great, right? But these are the little victories that we're trying to take, right? Then all the way in the north, great hippo sanctuary, right? So this hippo sanctuary is great, right? There's a rock that comes over the hippo pond, and you can actually sleep on this rock overnight. It's great. It's amazing. And there's no light pollution, so you see all the stars at night. It's a great place to go visit. But then again, same issues, no clinic. The closest clinic is probably like 140 kilometers away. They were like, hey guys, we will help you build a clinic. This clinic we haven't started. We run into a few logistical issues and getting people, there was some one educated girl in the whole community, and she was given pushback and this and that. We got to sign this papers and that papers. So that slowed us down, but that's okay. That's okay. These are challenges that you face going into some other country trying to help them, So we haven't been able to get things done because this one educated girl is giving pushback. She wants us to sign this document like, hey, you're going to come in and not hurt us. It makes sense that she's protecting her people, but, so we'll hopefully at some point can get going on this project, right? Then there are a few projects in there that we are planning, on the mountainous areas. We're trying to put together. We got together with the local kin, right? This is the kin of this place, and he's dressed in his fancy clothes. They pick him up. He doesn't walk on the ground, and we engage him and talk to him. Hey, this is what we want to come do and do a little bit of healthcare in your community if you can give us support. He was excited. He was amazing, and he was really supportive. He was like, hey, he will give us anything we need to be able to build this. He'll gather the whole community to come together and build a health facility for themselves. And he was the most supportive king that we've ever met. You know, he's incredibly supportive. Unfortunately, we haven't started the project yet. We will start soon though. But this is the this is the plan that we will be putting there because we have such strong support from the king. We're trying to put up a bigger facility there, right? Which will be our assisted living facility where, you know, all these places when people are sick and that small clinic in that local village won't be enough. This is where we'll shuttle them to, right? So they can get more long-term, better care, right? And we will do that with the help of this king. Then let's move away from Ghana into another country, Mauritania. So this is Senegal in here. And Senegal, and just north of the Senegalese border is this country called Mauritania. Mauritania was a large country in the world to abolish slavery in 2004. So 90% of this population is black, and 10% is non-black. Unfortunately, the 10% are the ones in power, and there's a lot of suppression, and the black folks are really not treated well at all. You know, a lot of this place is no health care whatsoever. You know, there's health care in the capital where the 10% non-black live and they hold on to the power. So like vast areas of like just underserved areas, you know. So we wanted to start off in this village here called Juru. When I was at UCLA, there was my colleague doctor there. He was from Mauritania and he was from this village called Juru. And you really have to, you can't even go to the capital and take a plane, you know, because the racism is so strong there, you know. So he has to sneak out. He's an MD with all this money he can get, but he still can't go to his people. He has to fly into Senegal, get back here, and then find his way there. So can you imagine the healthcare disparities in there? So, you know, we are finding ways to build a facility there here in Juro. We just gathered the team, and we recently just made our first contact with the community, engaged the community. And we're like, hey guys, you guys don't have any clinics. It's like, oh, what's a clinic? We don't even know what a clinic is. They don't even know that there's something called healthcare, right? That's how bad it is. But yeah, please accepted us, and we'll be going in there. We gathered the team, and we have our plans ready, and we will be putting up a clinic facility in here, right? That we are really excited about. Then there's South Africa, right? This is bougie Cape Town, all the cool spots here. Then there's this side of South Africa, which is the poor part, right? Durban is like the richest city. It's like the richest city in this area. This is where has anyone heard of the Zulu Kingdom? The Zulu Kingdom is right over here, right? And they're the poorer part of South Africa. And so we recently engaged the king. The Zulu king just died, but his new interim king, randomly we got to him, and he really just gave us audience, you know, and I just can't believe it. He's like almost like a president, you know. But on December 2nd, we are traveling to meet the King of Zulu, and then we'll engage him with our plans to bring some healthcare facilities in this part of South Africa. We'll help them build some clinics for themselves, revolutionize healthcare in that part of South Africa, and we think we can do it, and we're excited, especially knowing that we have this big king's support, that we will meet him, and we're really excited about that. And this is the part that they potentially will make us put up a clinic in. Just right next to the coast, a small village there with not much happening there, and it will be good. It will be good. See all these small houses with nothing going on in there. It would be great to help them out, right? And this is the plan that we drew for our facility in South Africa. You know, it has everything: a lobby, radiology lab, educational room, and this and that. We have our inpatient rooms, our ICU here, imaging, radiology, surgery, and all that. So this will be a bigger facility, and we hope that will be a referral point for the countries around South Africa who can get care. People can go over there, right? So we'll serve a larger area. So we're excited about that. Then there's Bahia in Brazil. So there's Brazil here, and there's Salvador, and then in the middle of Salvador is Itapuã, right? Salvador is a great place. There's great architecture right next to the beach. This thing here is the world's oldest elevator. Apparently, it's the world's oldest elevator in service right now, and it's in Bahia, in Salvador, in Bahia, in Brazil. So Brazil has government-sponsored healthcare, but it's not good. Not the rich people don't use this, right? So the people here usually don't get the elite healthcare that most people want, right? So a church pastor got in touch with us randomly, somehow, through word of mouth. They heard of what we were doing in different countries, and she's like, hey, I'm a pastor. I'm retiring from being a pastor, but I have my church. I want you guys to come to Brazil and bring your program to Brazil and convert my church into a clinic facility and help women and, be able to have a women's clinic there. And we thought that was great. So we are in the process of converting this church into a facility so women can give birth, OB/GYN services, birth services and all of that. So this is the inside part of it, and we're still working on this, and this will also hopefully be done soon. We're thinking probably March 2022. This clinic in Brazil will be done. We're excited about that, and that's part of the team. The team here, a lot of these midwives and nurses. Myself, he's a physician assistant. She's a pharmacist. She's a medical assistant, and these are some nurses and midwives that we're working with. And then we want to put up a bigger facility, which will be a referral point for all the smaller clinics. It's a really big facility where, if someone has a non-simple illness, right, a major illness, something big that the small village hospital can't handle, at least the small facility, they can see it and realize that, hey, this woman is having a really big issue and she needs better care. And then she will be referred to this facility, right? So these are a few plans of the facility there. You can see we have our operating room, the theater here. Induction, most importantly, this is where women can give birth, right? They can induce women and they can give birth here. If you look at this, we wanted quick emergency care. So the ambulance comes in here to the emergency room, to the pre-op area, to the theater, or to the pre-op area, to the induction room. Very seamless, right? Boom, 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 right? So that if you have an emergency, someone comes in and they're seen very quickly. There's a lab and there's a pharmacy, and there's the imaging areas. Here we're gonna have a radiation for cancer treatments and lounge and injection, reading rooms and all that stuff. And on the second floor, doctor's lounge and all these wards, nurses station. We're really excited about this, right? Then our consulting rooms on the left hand up floor, which would be a major referral point. So what we're trying to do is definitely women's health, right? Impact women's health, but also the social aspect of women's health, right? Sometimes in these places, girls, 18-year-old girls get pregnant and they give birth, and that's the end of their life. They can't go to school anymore. They have to stay at home, and that's also healthcare. That's also part of healthcare, and we just came up with this She Matters program where we want to support and empower girls, empower women when they give birth and all this. They will still be able to have a normal life, go to school, and become whatever. The reason was one time we were in a village, and then there was this girl. She came up to me. She may have been like 20, and she had a little cute 2-year-old baby, and she was like, you know what? I believe I'm gonna grow up and I will be the Chief Justice of this country, but I'm not in school right now because I have a baby. So this girl, smart girl, believes that she is gonna be the Chief Justice, but there's no path for her to go to school and go to college and go to law school and become the Chief Justice, and that's not good, and that's a disappointment, So as part of healthcare, taking care of their healthcare, we need to provide avenues for these girls like that, right? So that they can have safe childbirths, and when they give birth, they also have a way to still maintain their normal life, be able to go to school and empower them, right? So we also we have a group from the UK, 3 girls from the UK who just joined us. They were independently thinking about how to empower women in Africa, randomly, independently by themselves, and we somehow collided, and they became part of us, and they are just working on this, finding creative ways to support all these girls in these different areas so that, we'll find social programs that the kids can be in, support them to be able to go to college and all these things. And I think we're really excited about that. Preventive health. Money is a big part of healthcare, right? So with preventive health, you prevent the illness before, instead of treating it. It's much cheaper to prevent than to treat, right? The whole bottle of metformin for diabetes for a whole 3 years costs like $2, right? But to treat a heart attack, it's probably like $30,000 for one surgery, right? So it's cheaper to prevent than to treat the illness itself, right? Then this was a game changer, telemedicine. Telemedicine is what we are introducing that is totally going to change what we're doing. So in all our clinics that we're building, there will be doctors in there that will also have telemedicine capabilities, right? So any woman anywhere can be seen by a doctor, no matter where they are, right? So with our telemedicine services, all you need to do is to go online, and when you get on our website, there's only one button that you have to click, and with the click of that one button, you automatically generate a video visit with a doctor, right? So automatically now we have clinics scattered all over, but with our telemedicine program, we can reach any woman anywhere in the whole continent, right? So that's a total game changer, right? And the question was, man, but in these places, these remote areas that they don't have internet, right? So what we did, going along the lines of letting the people solve their problems, women's empowerment, we got 3 girls together. One was an IT engineering and 2 were software engineering. We're like, hey, we're bringing this telemedicine, but we need people to access the telemedicine program. There's no internet, right? And these girls got together, and can you imagine they developed a new networking system that all patients anywhere can connect to our system without the use of the internet. Brilliant. It's like a totally new technology, right? So they are part of our team. They're the IT team, and they've developed a way that any woman in some village, wherever, without an internet can still access our video telemedicine. Don't ask me how to do it. Yeah, but it's really cool, and we think that's great. And here's the thing: we also developed what we call these larger drones, right? Not a small drones we use to take videos, larger drones that have a much larger range. That if a woman 300 kilometers away generates a video visit and she can't get to the doctor can't get to her, but the doctor realizes that, oh, I can guide you through your childbirth, but you need an oxytocin so you don't bleed to death. This drone we can deploy, right? The drone from 300 kilometers away and fly the drone and drop the oxytocin or whatever medication you may need, right? Which is really cool. Is what we think that we've been able to solve that issue. Money, all of this costs money. The question is, how do we fund this, right? So again, I was like, hey, I don't have any. I funded this, by myself, but we're getting into some territory that I probably can't fund it anymore. So then I got these students together again, like, hey guys, how do we fund this, right? Find creative ways. We found 3 ways of funding this whole program. One was to sell the naming rights of each individual clinic, right? And we were able to do that. For example, one of our clinics, we sold the naming rights to some rich Persian guy on Long Island, and he bought the naming rights. He'd never been to this village, by the way, but he wanted to name it after his mom, who had passed. And in return for naming this clinic after him, he funds the whole clinic and funds the whole operations of the clinic, which is one way of funding it. There are 2 other ways of funding it that we're still developing, and that's by getting the really poor people in these areas, even though they have no money. If you can get all the poorest people in these areas, 1% of them to donate 3 cents every month, it pays for all of this. The question is how to get them to do that. There are a few other funding models that we are chasing that are still not really defined yet. One is time, right? So people can pay in time. We don't want to charge the women money. They don't have any money, but they have time, right? So if the woman is going into labor, that's going to cost 2 days worth of work. So her husband can, do something, work with us for 2 days or do whatever, right? And that you can actually monetize that. You can monetize that time. You can have them work in some sort of capacity, and get money from that and support the operations of the clinic. So you haven't really charged them, but you've found a brilliant way to get them to generate money, and those are some of the funding models that we're trying to achieve. that's our website, and this is the button. You click this, and automatically you get a video visit. Here that we're really excited about. And in this December, in 6 weeks, myself and a few pre-medical students are here at Ohio State. We're going to Africa to open some of these clinics and engage new communities and build more clinics in different communities. And we're excited. We think that we can do it. The next approach is South Korea. We met some colleagues in South Korea who want us to engage and come to South Korea and find ways to bring women's health and learn about South Korean culture, learn about the people of South Korea, and see what the medical problems are, and hopefully solve that problem for them. So that's what I have today. Any questions? Ooh.
Yes. What inspired you? Like, when did it start?
Great question. So what inspired me was when I was a first-year medical student, I went to med school at Albert Einstein College of Medicine. And the first year, they randomly were like, hey, we're going to give you $3,000 to go abroad and do whatever you want. And they were going to give myself and my buddies that, right? And they were like, wait. My buddies were like, wait, you are the guy from Ghana. Maybe you should come up with something. So then that was the catalyst to get me to get things going and start.
Cool.
Yeah, and then it just kept snowballing, and now went from Ghana to Mauritania, South Africa, Brazil, now South Korea, and it just expanded. And yeah. That's a great question. So with the staffing, we will use local expertise, right? Local nurses and doctors. Our model is, in the smaller clinics, one doctor, multiple physician assistants, right? One doctor, multiple PAs, and he kind of will oversee them, be able to do more work through that, and it's cheaper that way. And some midwives and nurses, and a lot of times these midwives and nurses, they're very capable in these small communities. They're able to do a lot, they're able to help a lot of people. So that's what we're trying to do. In terms of supplies, what we've done is there's an organization in the United States called map.org, and they do that. They basically get supplies from different hospitals that yet to expire in the next 16 months, right? But the hospitals need to get rid of, right? So, but not really bad stuff, So then they get these things, and then we can buy. It's not free. We buy it at a much cheaper rate, and then we ship it out, and that's how we do it. We just shipped up a supplier some stuff maybe like 3 days ago, maybe like last week, and then ended up last week. So yeah, that's how we get stuff for much cheaper than we would buy on the real market. So. Question? Yes. Repeat that. That's a great question. So initially, I didn't think it was doable. I was like, oh man, I'm just playing around here. This is not gonna work. So I did not think it was doable. Sometimes not. I probably still don't think it's doable. But I still did it. I'm like, yeah, man, this is not gonna work. You're trying to solve a whole continent healthcare issue. You can't do it. It's too big. So I didn't think it was gonna work. I just did it anyway. And the more I did it, the more I got closer. Then I found solutions. Then I found ways by which maybe this could work. Then trial and error. So that's how I did it. I just had to find ways to motivate. And then like this year, I'm going with some pre-med students. Some of the classmates. That are coming with me in December. Sometimes I get motivation from them. Sometimes they come up with great ideas, and that's why I bring the students with me, because they see my blind spots. They see things that I don't see. For example, challenge the naming rights. It was some students that worked on that. They were Stony Brook University students that came with me, and they were like, "Hey, dude, maybe we can do this." And I was like, "Oh, that's a great idea." So that's how, I've done it. And then how? Well, I guess being a physician, you probably get a little bit more than the average person. So that gives you a little bit more firepower to play around with. And I don't have any family yet, so it gives me an excuse to kind of do that. So yeah, so, Um, you said these are all like educational. That's good. Yeah, so great question. So there is educational infrastructure in the big cities, right? In the big cities. So the question is to convince someone who lives in the city to go live in these places, right? And that's why when I go, I just bring them and I get a whole bunch of nurses and doctors and physician assistants from the city, and I take them with me, right? So hopefully I'm with them for 2 weeks, 3 weeks, and I try to like work on their psyche, right? I'm talking to them and trying to convince them, not brainwash, but brainwash them, and trying to get them to buy into my vision, and they're with me for 2 weeks, and I make them have fun. We go into these places and like, hey, let's go to waterfalls. We go to the waterfall, we go to the safari and see animals, so they're having fun. So subconsciously they don't realize it, but they're associating that experience with positivity and fun, So I slowly over time work on them and get them to convince them to, be part of the whole project and go live in some village and take care of people, So it's not easy, but sometimes, I'm able to do that. I'm able to slowly get people and preach to them like, hey, dude, this is a problem. We got to do this. Someone's got to do it. I'm like, the one thing that gets to them is, hey, I'm from Los Angeles or Columbus, and I came all the way from Columbus to this village. So you have no excuse to go from the city to this village. You've got to go because I went. So, and usually they're like, well, you're right, you're right. So that usually gets them, But yeah, it's not easy, but yeah. That's a good question. How do I do my research? Research on yes. Excellent. That's a great question that I did not address, and thank you for bringing that up. So, excellent. Before I bring a solution, I need to understand the baseline, what's happening on the ground, right? So that you can have a baseline, bring your solution, and then test it afterwards and see how you've done it, right? So you definitely need to get in the community, get on the ground, and gather some data, gather some information, right? So I get there. I do go to the communities and I do gather some data, but the real data gathering is there's a consultancy firm in the country that I hire. I pay them next, and it's like they think that they are overcharging me, but it's like just a couple of $100 bucks, and they go into these communities. They're like, oh, this guy, he doesn't know. He's paying us $200. Oh my goodness, this guy. But there, it's like only $200. And then they would go. They'll gather the whole team and they'll go into the community, get on the ground, and they're PhD people, so they're like real experts in data gathering. So they do that, and they bring me the data, and I put my name on it for $200. So I do that. That's how I can get the data. Because it's just not possible. I'm here, I'm working, and someone's got to get the data, and it's just not going to be me. But that's how I do it. And resistance, right? Resistance in terms of like sometimes you get resistance from multiple areas. So you get resistance from the people themselves, the people you're trying to help. You get resistance from them, and sometimes part of doing global health is saving the people from themselves. So it's a slow process. There's no one way that works. Sometimes you got to find multiple ways. Talking to them, being persistent, and realizing that when someone is yelling at you for trying to help them, that's part of the work, right? To accept that and not take that person like, oh, you're done with me, I'm done, I'm going away. No, it's okay. Find ways. Maybe get an adult. Maybe get someone else who is from the the village who lives in the city, who understands things better to come advocate on your behalf. So multiple ways, trial and error. Eventually, you may be able to break through. When you get resistance from the staff, you just have to find ways, keep talking to them, entice them. Sometimes money can go a long way. Someone doesn't want to go to the village. Oh, I'll pay you twice as much as you make in the city if you go live. These little tricks that we do. Sometimes you also get pushed back from the authorities, they, for no reason, just for stupid reasons. Like, oh, you want to build a clinic, you can't build it. There was one time, the councilman is like, you can't build a clinic here because it's not in our plans. I'm like, how does that make any sense? You can't build a clinic because it's not in our plan. Like, building a clinic is not in our plan. I'm like, you are the worst councilman ever. So sometimes you get those kinds of pushback, and those people in power, I just avoid them. I just go behind them and I just deal with the chiefs. The chiefs usually, and the Kents are usually more willing. They want, stuff to be done for their people. So I avoid the political leaders and go into the Kents and the chiefs, and they usually work. Sometimes I get resistance from my own self. I'm like, oh man, I want to go on vacation to Jamaica, and why do I got to go do all this stuff? And then that I have to sleep, and maybe when I wake up, that resistance will go away. Any other questions?
Yes, my question was more so for pre-vested to me. Study abroad and do things like that would get them into that sector.
Yeah, there's always funding available. There's always opportunities available. Like for example, my program, I open it up to premiums to come along and get some a couple hundred hours of maybe a week or two to put in your resume, and there's always funding ways we can find money around the hospital somewhere to get it to go. So I think that there's always opportunities. The problem though is finding these opportunities. For example, if I hadn't reached out to you, how do you even know that I exist and I'm doing this? So sometimes finding the opportunity is also tricky. There's no right way. Just by talking to people, talk to people, multiple people, talk to one doctor and that doctor, and then they will know someone who knows someone who's doing something that you want to do. So just get online and find these physicians and email them and bother them, and you find. Great question, because I have to send funds a lot to these places and these clinics and stuff like that. One thing I realized is that, so for example, now what we do is we get student groups to go into the communities, and the students from the cities will go into the community and help organize the community and build it, right? So sometimes they need funds. The one thing that I realized unanimously was that every time you select a guy as the leader of the group, he will spend the money unequivocally. It always happens. So now what I always do is that every leader is always a girl, and they are a lot more trustworthy, and it happened a lot. Initially it was the program was going very slowly, and I hate to sound so sexist, but it really is the reality on the ground. You get to these guys, they're 22-year-old guys, they want new sneakers, new phones, and you give them money and they go blow it. But the girls, it kind of pertains to them, So they're, so that's the one thing that I have learned through trial and error. And I also realized that the older folks, like if you find like a 35-year-old guy, like, hey, you want to come be the project manager, he will also spend all the money. Because I'm here in Columbus, you need someone you trust. But the younger folks are more trustworthy. They're 19 and 20 with no responsibilities. They don't have kids and wives that they have to feed. So that's one thing that I made a lot of mistakes, through all those inefficiencies. And I realized that no, you want to trust the younger ones, get 2 boys, 2 girls, and make the girl the leader and give all the money to the girl. And then the 2 boys, 2 girls who are young will go into the communities. It's more efficient. They're less likely to run away with your money to go pay their kids' tuition or whatever, So those are some of the things that I. You mentioned language barriers. How do you handle those? That's excellent. That's excellent. So a lot of times, a lot of these places that we go, I can't even communicate with them, right? So, but usually there'll be one person who will speak English who will probably be our translator that will, use. Because a lot of times to get into these places, I always have that one contact. For example, in Brazil, that was through my colleague at UCLA who speaks Portuguese. So going to Brazil, she leads us and translates for us. Going to South Korea, there was this pre-med student who is from South Korea who will be leading us to South Korea. So I usually have a contact who maybe has some association with the place or whatever, and then that's how we get in there. Yeah, there are a few other colleagues who want to partner, like my friend who's also a doctor wants us to go to Colombia, Bogota, and do all that. I guess she will probably translate Spanish for me because I don't know how to learn Espanol. So, yeah. Any other questions? Okay, great. Well, guys, this was fun. And I've enjoyed talking to you. The one thing I want to say, it looks like all you guys are pre-med, so definitely keep pushing, work hard. There's multiple the opportunities out there to have fun later on. Now, just sacrifice it all and put all your effort into it and keep doing it. I will be a little selfish and say that you should all go into nuclear medicine. This is my field. I love it. It's the best. I initially, like I told you guys, I initially did general surgery, and it was fun. It's good to be good with your hands, know how to cut. But the intensity, I realized that, I probably need a good quality of life. And you get at the end of the month when you go see your bank account, it's very exciting. So I think you should definitely go into nuclear medicine. Come to Wexner, come shadow me, come shadow my colleagues and learn about nuclear medicine. If anybody asks you what you want to do, say nuclear medicine, right? It's the way to go. It's the only field in medicine that's like nuclear medicine in terms of quality of life is dermatology, right? Because we read our scans, we take care of our patients, and 5 p.m. we go home. We don't take work with us. But if you're a surgeon, you go home, they're gonna call you back, this and that, But our field, the best in all of medicine. So definitely, you guys should all study hard, get into med school, and when you get into med school, consider nuclear medicine. You can just go and Google the average salary of a nuclear medicine physician, and it's definitely will blow your mind. Yeah, I would actually show you here, but it just wouldn't be too professional. But yeah, definitely work hard, and it'd be great. Okay, and I know all you guys is gonna be amazing doctors in the future. I have no doubt. And definitely email people, email doctors, and come shadow. If you want to come shadow me, reach out to me, and Courtney has my email and stuff. And nice meeting you all, and you guys should enjoy the night and your semester.
Thank you. Before we all head out, can we get a picture with you?
Sure.
Oh, really? Okay. Thank you. And do I